case for fails for 2-6 or 2-8 region, I'll go for a posterior superior alveolar nerve block. When my direct technique fails, I'll go for a Gauguin's. Even that fails, but I wait for some time. Local techniques I teach you. These are the things directly poking or drilling into the bone and giving the LA. Some systems have come. Next. Intrapulpal, I think endodontists will have a lot of experience. So, but even I had a lot of failures giving intrapulpally. Then I learned my own technique from the material which they use. Next. And intraseptal, intra-ligamental along the axial surface of the tooth. Again, I am just asking a simple question, sir. When the water is leaking the tap, again you are poking the tap. What's the use? Attack the gate wall. So you are doing everything here local. So your proper techniques you learn, you will be successful. Pain won't be there. Then trying this. Maybe gate control theories which takes impulse from here. That also after a proper block. Right? Next. This is a very good drug. I had an experience of treating the VIP. 3 shots, it was a failure. I tried Orticide. It was working. Even a little bit of abscess. The mechanism of action, I don't know how it is disproved, but it is better. It has a better diffusion. Slightly buffered to manage the acidity. You inject in the labial side, it penetrates through the palatal also. And the most of the time LA on the palatal aspect is hurting. Because here you have a lot of structures like mucosa loose. The palatal mucosa is thickly adherent to the bone. You give a LA, the mucosa is separated from the bone, which hurts you. So we can use the end of the handle of the mouth mirror, give a pressure for 30 seconds, you can give LA. It won't hurt. Orticane avoids palatal infiltration. And when LA is failure, alternative techniques I spoken to you, the alternative drug is Orticane. Right? But if the technique is different, okay, then we are not into that. This is buffering the LA which you have. Next. Newer techniques for local anesthesia, not with this presentation. LA failure using these techniques, I don't think it will be successful, but you have to know. When the LA is, giving LA is a fear for the patient, patches are there, dainty patches, give this patch, then poke the patient, it hurts less. Maybe the day will come when you give a patch, it diffuses everywhere to pull the teeth. Jet injection, it doesn't have a needle, but with a heavy pressure, it diffuses the LA into the bone. This is control release. You yourself can do without buying this machine. See what I do and my friends do, they just first prick, give a drop, painless. Then when you keep penetrating, keep injecting the LA. The machine does it. Why don't you do that? That's a control release. But see again gate control, give some pressure and vibration. Again you have to give an LA. Next. This is a syringe. It perforates a bone, makes a hole. Then you inject LA, maybe diffusion may be very good. This is maybe it may be funny and people won't believe it. I'm doing it for more than 20 years. When multiple failures of 2 blocks, 3 blocks, when people call me in the college or something, even myself, when the gate control theory says one conducts a faster pain, one carries the faster pain, one fellow carries a very severe long-standing pain. Both the fellows has to enter through this gate. But you hit this A fellow with the angry, he'll stop the C fibers. So when you stimulate, see the painkiller paracetamols, all those things control the headache. There's different scenario, different NSAIDs. But aminogen is an NSAID. Vicks is an NSAID. How it works? Counter irritant, pressure, warmness, heat, burning sensation. That carries the information, that blocks the information, which carries the headache information into the brain. So that's, I have seen people putting iodex into the teeth cavity. I've seen chemical burn. They put salt and rub it. So at least everyone would have had that experience in the clinic. They take a crystal salt and nice little bit. They'll come and promise they didn't do anything. And the bad luck is, I have done the extraction. After 2 days, they'll come and say, "Sir, pallu edukuma ipdi illa sir, ippada apdi irukuma." So sir told no documentation. I'm not documenting, but I'll take a picture and keep it. When you see abnormality, the first thing, please take a picture, sir. Please. I had a problem. They rubbed it nicely and they came with the salt or something they rubbed. After the extract, he came and told, sir, I think you used old material, expired material.
Axe burned oil, sir.
What?
Axe burned oil.
Axe oil.
Imagine a bike mechanic. He used the oil which he had. So those things, but why don't you use a eugenol? Okay, like Amazon and Vicks, no. For a dentist, eugenol is the best dose. I still use eugenol in a canal, sir. Sorry, don't mistake me. Use a formacrosol. After I do multiple sittings, I just after removing the pulp, I take a cotton, dip it in eugenol and do a close dressing. Only eugenol, not even. So eugenol is a counter irritant. So when a couple of times the patient fails with a LA, I mix a lot of eugenol, little bit of powder, take it and put it in the socket and induce the pain. You jump, sir, please wait. Then compress the buccal and lingual cortex for 2 minutes. Then another 2 minutes also been bite with the eugenol inside the cavity. Okay, I given an infiltration also. Then added to this, I'll do this. But you people may question me whether the infiltration is working or the eugenol is working. Definitely Emmanuel is going to ask this after this lecture. I know who will be asking these questions. So, but I can bet because even LA was a failure, but this works. It is not carrying the pain information to the brain. I'll show you. This fellow is recently operated CABG. Within 6 months, you're not supposed, but he has severe pain. No, not ready for that treatment because endodontology is uncooperative, sending back to me. It's your fate sometimes. Okay, when there's a DC in 7, you're supposed to do an RCT, but they will first advise you to do a surgical on one of the 8 because they don't have an appointment on the day. So these are the things which happens. Sir, come. This one is in a hurry, Sunday, no? Mix. You want to mix something else today? Alan is there? I'm trying to pay attention to it to work out. It's a simple, stupid thing. It works. I got this thing indirectly from Bake sir. He's one of the senior most. He used to teach me how to just constantly give a. I kept the pack inside and see, nice pressure. Initially it will be hurting him, but within seconds he will feel the burning sensation. Within a minute it will work. Aram se you can take the extract, do the extraction. Okay, sir taught me to give a pressure in the periapical region. But it's very difficult to keep holding the finger for more than 3 minutes. Sir, it may be a joke or it may be very simple, but when the LA fails, and many times extraction, people do open heart surgery, all those things, the big setup. When you fail in one extraction, you will know that how difficult the dentist is. I have to tell to the legal advisor also. The thing, everybody charges more for extraction, we charge very less. But when it fails only, we will know. We will regret sometime why we did oral surgery or extraction. It will be very difficult. So, and when they short with pain, you will be irritated, you will be shouting at the patient. You will be the loser, he won't come back to you.